Good evening, brothers and sisters. We want to welcome you out to our fifth and final evening workshop that Dr. Matt Nelson has put on for us. We want to thank him so much, and he and his wife Brandy, for sharing their Sunday evenings with us for the last 5 weeks. We appreciate their efforts so much. As many of you know, Dr. Nelson is a clinical psychologist in the Air Force and works as the Director of Mental Health Operations at Nellis Air Force Base. He was awarded the Psychologist of the Year in 2016 and the Surgeon General Research Award in 2015. And so we're pleased to have him here. We want to thank those who have helped set up everything through the 5 weeks as well. President Thomas for helping get all of this organized. Mark Warden and Greg Carlson for involving the translation services. We'd like to ask Sister Marilou McClellan if she wouldn't mind giving us the opening prayer, after which we'll turn the time over to Dr. Nelson.
All right, so mic check. So how are we doing on sound in the back? Do we sound okay in the back? All right, good. So listen, thank you for being with me for this time. Many of you have been with me the whole 5 weeks. Some of you, this is your first night here, and that's great. We welcome you here. Obviously, tonight we're talking about sleep or people who struggle with sleep. And so you definitely do not need to have depression or anxiety to struggle with sleep. Sleep problems are a very, very common problem. But I'm just grateful for you to be here tonight. It will be a fun evening. This is probably maybe one of my funnest things to teach. Because sleep is one of those issues that plague many of us. And actually, it's fairly easy to overcome. There are some cool tricks that I'm going to teach you tonight to hopefully help a variety of sleep problems that you may experience. So while we wait for a few stragglers to come in, which we always do, I want to give you a story or two to kind of set the mood for tonight. I was looking up scriptures. I always like to use scriptures in my lessons, and really there is not a lot of scriptures about sleep in the scriptures. So there's a prophet who wet his pillow by night. There's some guidance for us to go to bed early and wake up early, which I tell my wife all the time. So Brandy, so you know, and she says I can pick on her tonight, but Brandy is like a teenager, and she can sleep till 10 o'clock every day of the week if she was allowed to. Unfortunately, life gets in her way, and she's not able to do that very well. But bless her soul, she has the gift of sleeping. And so she told me, I said, give me a story that we can start off for tonight. And she says, well, here's a great story. And so I'm going to tell you 2 tales of people who sleep really well and some who don't. So we'll start with Brandy, who sleeps very well. She was on the girls' camp committee one year and sleeping in the cabin with the girls. And there in this place that we were living at the time, there were bears. And so they said that if you had to go to the bathroom in the middle of the night, you had to take someone with you, a leader with you, to the bathroom. And so the young women leaders didn't want to obviously get up in the middle of the night all night to do this with the young women. So they said, hey, don't wake me up, just hold it, right? And so one morning, one of the other leaders approached Brandy with this story. And they said that in the middle of the night, one of these young women got up and they tapped on Brandy and they said, Sister Nielsen, I've got to go to the bathroom. And Brandy said, you'll be fine, just hold it, go back to bed. And so the young woman, she did. She went back to bed, and this other leader who heard this conversation is like, I'll just wait a couple minutes. I'm sure Brandy's just pulling a joke on her because that's what Brandy does. And Brandy never did. She never woke up. And so eventually this other young women's leader said, hey, I'll take you to the bathroom, and took this young woman to the bathroom. So that's Brandy. When in our... Huh? Oh, yeah, Brandy didn't remember any of it. So Brandy had no recollection of any of this conversation, none. The same thing happens in our home when our kids throw up. They'll come into our room and they'll say, Mom, I just threw up. And Brandy will say, oh, that's too bad, go back to bed. Right? And I'm thinking, are we serious? Like, is this really happening, right? They got to throw up on their pajamas, on their bed. And so the opposite side of the spectrum, would be me. I'm a very light sleeper, so I almost always go to bed before Brandy does. I'm usually asleep. So one evening, Brandy comes in through the door. She opens the door, and I sit up, and I start screaming, "Who is that?" who are you? And then she's like, well, it's me. And I took my pillow and I threw it at her as hard as I could. And she said it hurt. And you know, and I was like, oh, after I hit her, and she's like, ah, you know, and I was like, oh, and I woke up and I was, you know. But now she knows I'm going to protect, like that's what I'm going to do. Fight, flight, or freeze. I'm going to fight, right? I'm going to fight for my family. So now we know, don't come into my room in the middle of the night. And that's why I don't, you know, we don't have any weapons in our home, period. But if I did, I wouldn't have it by my bedside because I probably would use it without knowing. So anyway, so that's my story on sleep. Depressed people, so in general, sleep issues is a very common symptom of depression and anxiety. As we said, you know, you don't have to be anxious or depressed to have sleep problems. But a symptom of depression oftentimes is they oversleep. So they don't want to get out of bed. They sleep too much. And so I don't, you know, so my tip for that, if you are an oversleeper, the only thing that I'm going to tell you is to stop it. Set your alarm. Don't push snooze. Get out of bed. Force yourself to drag out of bed, whatever you have to do. Drag yourself onto the couch downstairs or whatever, but get out of bed and just do that, okay? So this workshop today is not going to focus on oversleeping. We're going to be talking about undersleeping. And so one thing, the big thing that we do, so there's a few, hopefully you all have a handout, so there's handouts in the back. If you didn't grab a handout, grab one of the handouts. Also grab a writing utensil. So there's a few things I want you to start writing down for me real quick, because these are important numbers that you need to use to understand if you have a sleep issue. So the first thing I want you to write down is what time, on average, you go to bed, to your bedroom. What time, on average, do you go to your bedroom at night? What time, on average, do you go to your bedroom at night? And maybe I shouldn't say the bedroom. Maybe I should say, what time do you go to bed? What time do you try to go to sleep? What time do you go to bed at night, on average? So what time do you try to go to sleep? And then the next thing I want you to write down is, on average, how long does it take you to fall asleep? How many minutes, how many hours, whatever. On average, how long does it take you to fall asleep? Nope, because you already tried to go to bed. So even if you get out of bed, what time do you eventually fall asleep? Okay, so the question was, even if I get out of bed, no. So you already tried to go to bed, right? So that was the first time. The second time is the time you actually fall asleep. The third thing is, how many times per night do you wake up? How many times per night do you wake up? And then, yeah, it doesn't matter. I mean, if your kids, on average, how many times per night do you wake up? Doesn't matter if it's on your own to go to the bathroom or get a drink or whatever, or your kids come and wake you up if that's a daily occurrence. I don't know. We're all a little different, time and season. And then, again, on average, how long does it take you to fall back asleep once you wake up in the middle of the night? Okay, so if you get up to go to the bathroom or to get a drink, how long does it take you to fall back asleep? And then the last thing on there, I want you to write down, on average, what time do you wake up in the morning? On average, what time do you wake up in the morning? Okay, now I need you all to do a little bit of math. I need you to calculate how many hours per night you are actually sleeping. Okay, on average, how many, look at your paper, look at all your numbers. I need two numbers. One, how many hours are you trying to go to bed? You're in bed, you're trying to go to bed to the time you wake up. What's that span? Is that 6 hours? Is it 8 hours? Is it 5 hours? Okay, what's that total time? And then I need you to find out, it will be smaller, how many hours, or no kidding, are you actually asleep when you're trying to sleep? Well, if you wake up, well, that's why I asked you. So if you see, the question was, is if you wake up in the middle of the night, do you have to put a time limit? Yeah, that time limit is how long does it take you to fall back asleep, right? So how many times are you awake at night till you wake up in the middle of the night, and then how long does it take you to fall back asleep? Okay, so you need to calculate all of those things. And we're going to calculate your sleep efficiency. Okay, to do that, you can pull out your phones. So it's hours you actually sleep divided by time in bed. Okay, so when you have your numbers, go ahead and pull out your calculator on your phone. And I want you to calculate your sleep efficiency, which is how many hours you actually sleep divided by the total number of hours you're in your bed. Okay? All right, so I'd love to hear a few of these numbers. If you have a sleep kind of issue, tell me what kind of numbers we're getting here. What am I working with? Huh? 7.5. 0.75, right? 0.75. Yeah. 0.75. 8? 0.8? Anyone else? 0.26? Oh, 0.625. I was going to say, man, 0.26, that would have been awful. Okay, 0.625. Others? Okay. What the Academy of Sleep Medicine has said that we want you to have greater than 0.85. Okay, if you are not getting 0.85 or 85% of your time is not sleeping when you're in bed, then you probably have some sort of sleep issue. Okay, so this is the goal. If you are above 0.85, then we would actually say that your sleep is normal. Did you know that waking up in the middle of the night is actually a very normal thing that we do as human beings? That's not an issue. Okay, but hopefully you're able to fall back asleep really quickly so it doesn't completely disrupt, all your sleeping. So this is the goal, 0.85. Okay, so that's just a good swag for you, a good kind of mark to figure out if you're having a sleep issue. Okay, the other thing that the Sleep Academy of Medicine has said is that they would like, their recommendation is that you sleep for 7 to 9 hours a night. 7 to 9. Okay, that's the recommendation from our medical experts. There are a lot of medical benefits to sleeping 7 to 9 hours a night. Your overall health is much better. Cardiac stuff, your concentration on your work that next day is much better. Your energy levels, lots and lots of things in your body just work better if you're sleeping between 7 to 9 hours. Now, I do know that there are many of you who sleep for 5 to 6 hours a night and do just fine, right? There are a few of you who sleep less than 5 hours a night and do just fine. I am not here to tell you how many hours you need to sleep, because all of us require a different amount of sleep, okay? A doctor is never going to prescribe to you exactly how many hours of sleep you need, because your body is going to be different than everybody else's. But we're going to get into the symptoms to help you know if your sleep is good or not and if you're within those normal limits. A quick comment on sleep medications, okay? Things like Ambien and those things that you can get. Those, again, are wonderful drugs that God has given us to help us sleep, but they should not be used on a regular basis. Should not. In fact, there are many, many studies out there to talk about the negative health effects of chronic use of sleep aids. And when I'm saying chronic use, I'm saying if you use them for more than 2 to 4 weeks. Okay, that's not what they're designed to do. In fact, your body can get so dependent on these medications that it can actually start to harm your ability to sleep well. Okay, so it can actually, in the long term, make you not sleep very good. And that's a problem that we run into quite a lot in my line of work, are these individuals who've been on their sleep medications for a very, very long time. They can't sleep without it, and in fact, they need higher doses, and then they're still not sleeping very well, even though they're taking all these medications. And then they supplement with over-the-counter medications, NyQuil and other things. Overall, please, please, please do not chronically use these medications. It is not good for your overall health. Okay, so we're going to teach you natural ways of kind of dealing, with sleep, and that's the goal for today. All right. So something else that I don't and I'm not able to treat are medical issues, medical sleep disturbance issues. And so I'm going to give you a few symptoms, and you can mark these off for you. If these are you, then there's nothing I can do for you. Okay? Do you wake up with morning headaches? Do you snore? Or does your spouse tell you that you snore? Do you have excessive daytime drowsiness? Meaning you're doing something kind of routine during the day and you, at a very high frequency, will doze off. Okay, if you are a driver or a passenger in a car, are you going to fall asleep? If you're sitting down and you're watching TV, are you going to fall asleep? If you have excessive daytime drowsiness. There's actually a good scale. If you think you have excessive daytime drowsiness, you can Google a scale. It's called the Epworth Sleepiness Scale. Epworth Sleepiness Scale. So if you feel like you have excessive daytime drowsiness, I would encourage you to Google this assessment, take it, bring it to your doctor, and show them how drowsy you are. I think that the cutoff score is about 12. So if you have, I think it's 12 or higher, then we would say that you've got some excessive daytime drowsiness. If you have these symptoms, it is likely a good chance that you have sleep apnea. Okay? The only way to really diagnose sleep apnea very well is to go and get a sleep study done, where you go in and they actually, you can give you a kit and have you do it at home now, but you usually go to a center, they hook up all these sensors to you, and you sleep there that night, and they measure how much oxygen you're getting and how many times you're waking up in the middle of the night due to not getting enough oxygen. Okay? Sleep apnea, I cannot treat. You need to either use a CPAP machine or you need some sort of surgical intervention. Okay, but that is a medical issue that you need to address through medical channels to help if you have sleep apnea. Okay, but sleep apnea is a real thing. It's a big issue. It's very, very common in our culture. And what it is you're just not getting enough oxygen as you're sleeping, which is making it so you're not getting into the restorative phases of sleep, and you feel very tired the next day. You're not getting all the sleep that you need. So if that's you, please go see your doctor, find out about potentially doing a sleep study because you may need to do that. Okay. Oh, the other thing that I want you to kind of do is if you feel like you want some help to figure out how to sleep better, and you want to go through a very strict program, you can get an app on your phone called CBTI for insomnia. CBTI, Cognitive Behavioral Therapy I, Insomnia Coach. So if you go on your phone and you go CBTI under the App Store, CBTI Coach, you can download an app, and it goes through all these things that I'm going to talk to you about, but it also has tools like there's a breathing exercise in there to help you breathe, to help you fall asleep. There's some sleep diaries to kind of help you keep track of your sleep, some really cool things in there that we have found to be very useful if you want an app to help you with that. Okay, so any questions about any of that stuff that we've talked about so far? The things that I can't help you with? Yes, sir. Great. So Brother Bullitt said that he has another app called Sleep Cycle. Is that something that maybe is connected to your iPhone or something that kind of tracks? Oh, it listens to your breathing. So there's an app called Sleep Cycle connected to your phone, and it will listen to your breathing at night and kind of give you some readings on what they think, how well you're doing based on your breathing in the middle of the night. So another good resource there. Thank you. Okay, so let's get into some stuff that I can treat. So For those on your list, when I had you write down those things, if you are having a hard time initiating sleep, meaning you go to bed at a certain time, but it takes you a certain amount of time to fall asleep. We call that sleep onset latency, but it's a trouble initiating sleep. This is something, it's in our wheelhouse, it's our bread and butter, we can really help you with. It's actually not super difficult to do, and I'm going to give you some tips on how to do that. Out of curiosity, I'm wondering who the record holder is in this room, if you don't mind sharing. How many of you take 4 hours to fall asleep? 4 hours or more? Ah, you win. How many hours? 3 to 4 on average. Okay, she's the winner. Someone needs to take her out to dinner, okay? Because that's really miserable. That's really tough. I mean, can you imagine kind of dealing with that on a chronic basis? You know, that is frustrating when you're laying in bed, you're trying to sleep, and you can't fall asleep. Okay, so she's the winner. But let's kind of go through some of these things. Okay. On your handouts here, I gave you a handout. We're going to go over what we call sleep hygiene. Okay, so sleep hygiene, if you think about dental hygiene is like good teeth brushing behaviors, good dental care behavior, there are also good behaviors that we can do to help us sleep better. Okay, and so I'm going to highlight several of these for you, and we're going to figure out for yourself which ones you need to implement. Okay, the first thing is that you should go to bed when you're sleepy. Sometimes people have sleep problems because they think they need sleep, but their body really isn't tired. You're not sleepy. So please don't go to bed until you're sleepy. Okay? Just stay up. Your body is saying, you're not tired. It's okay. Your body's going to figure this out. So if you've been having sleep problems for months or years, don't expect for your sleep problems to resolve itself in a day or two. Usually the sleep stuff that we do takes probably anywhere between 2 to 6 weeks. Okay, so give yourself some time, be patient with yourself. 2 to 6 weeks. If you do these things that I tell you tonight, within 2 to 6 weeks, you'll be sleeping better than you are now. Okay, so first one, go to bed when you're sleepy. Second one, once you go to bed, if you can't fall asleep within about 15 minutes, get back out of bed. Okay, this is all about brain association. What we're trying to do is train your brain that your bed is for sleep and sex only. Okay? Your bed and your pillow is not to think about your next day. It is not to watch TV. It is not to play on your phone. This is not what your bed is for. Now, you may say, well, I have lots of friends who watch TV in bed, and they don't have sleep problems. And I would say, you know what? Bless their hearts. Okay? Good for them. Let's not envy them. Let's just cheer them on. Okay? But if the number one thing, okay, the people that I work with who have sleep problems of initiating sleep, many of them, almost all of them, are watching TV in bed. They're on their phones in bed. They're doing other things in bed. And as soon as I take that away, within 4 to 6 weeks, they start sleeping better. Yes? Okay, so noises, right? So other things like music. Some kids, especially teenagers, they like to listen to music when they go to bed. Not great. Okay, so you're saying nature noises. Can we use nature sounds? And I would say no. The only noise that we want you to have, you can have a white noise maker. Okay, white noise. So you can have some noise, but it has to be one of those white noises. And the reason is again, it's about brain association. When I have nature sounds, to me that brings images. The beach and waves, I think of, wow, that's Hawaii. I want to be there. I want to be surfing. And right? So these bring images to my mind. It's not helping me initiate sleep. Okay, white noise is just boring, so that's okay. Yes, ma'am. Reading in bed also is a no. That is not allowed. Okay? So no TV in bed, no phone in bed, no reading in bed, no eating in bed, no paying your bills in bed. The only thing you do in your bed is sleep and sex. That's it. Okay?
Is it true that the blue light from computer screens and TV screens disrupts the brain function?
So the question was, does the blue light from the screens, from our phones, from our TVs, does it disrupt kind of our ability to sleep, or the natural cycles of melatonin and these other things. So I can't get into the specifics of that. I do absolutely know, I've read the studies that blue lights are very bad for us, but how it actually impacts the body, I can't say that. Sister Corny, I don't know if you've ever looked into any of that stuff. You're our resident doctor here. Blue lights are bad for you, okay? It does mess up your chemicals in your brain. So stop it, okay? Now that's very hard to do. It's very hard, especially when you have a spouse and you say, well, my spouse loves to watch TV in bed. What do? You really got to have that heart-to-heart with your spouse and say, hey, if you really love me and you want me to be happy and whole and not cranky the next day, then please support me and get this TV out of our room. Okay? What if watching TV is what puts you to sleep? So here's the problem. The problem is you fall asleep to the TV. You set a timer on it or something so it turns off automatically? No, it just runs. Oh, that's Todd's problem. Yeah, that's what Todd does. Gotcha. Yeah, that's not a surprise. When you are sleeping and the TV is still on, those lights as well as the sound are still being interpreted by your brain. Okay, your brain is still on. It's still filtering that information, so you're not able to get the quality of sleep that you need. So you need to ask Todd, your lovely husband, to watch TV in another room until he's sleepy and he can go to bed. Okay, so that's what I'm asking you to do. So I'm not asking you to not watch TV. I'm not asking you not to use your phone or to read or do these things that you do before bed. What I'm asking you to do is do that in a separate room until you're tired, and then go to your bedroom. Okay? Just shift all of those activities. If you need this time to wind down, it's good to have a wind down routine. Okay? I have mine. I like to read all my sports news and things like that before I go to bed. Okay? I need to do that in a separate room. And then when I'm ready, I go to my bed and I fall asleep. Yes? Yeah, so the question is like, well, what if my bedroom is my sanctuary away? How about if I promise that I not sit in my bed, but I sit in a chair next to my bed? Is that okay? So we have in the Air Force, we have some dorms, right? And these kids, they just have one room. And so when I tell them, do it another, they don't have another room. So what we do ask them to sit in a chair, okay? Sit in a chair, don't sit in your bed, don't touch your bed, don't touch your pillow until you're, so I would say, that's the next best thing, okay? If you have to be in your room because that's the only place to get away, okay, but don't go to your bed, okay? So let me give you a good example of why we say these things. So this is all about brain association. There's a lot of studies about brain association. When I was in graduate school, at first I tried to do all of my homework at home so I could be by the family because I didn't see the family very much. I tried to do my homework on the kitchen table. It took me forever to do my homework. It wasn't going very well. And then I said, probably Brandy got sick of me one time, and so she kicked me out. I went to the library, and I got to the library, found a little cubicle at the library, and man, I did the same amount of homework in a much, much quicker rate because my brain associated my kitchen table with games and dinner and playing with my kids and all of these things. In a boring library, there was nothing for me to do but to really focus on my homework and get that done. So then I started the rest of my academic career. Every time I had projects or homework I needed to do, I went to the library because I knew if I could focus and spend that time really working and focusing, then I could get home faster and spend more quality time with my family. Okay, so it's about brain association. It's about training your brain that certain environments is where we do certain things. Okay, again, your bed and your pillow are for sleep and sex only. That's it. I need you to take everything else into another room, into a routine that you do before bed, okay? Any questions about that? That's a hard one, okay? I'm not saying that this is easy. I'm saying that if you do these things, you will get better pretty quickly, okay? Questions, comments? All right. The other parts of sleep hygiene that you can read on these next several pages are things like caffeine use. Caffeine is a stimulant. I once was treating a guy who said he was drinking 2 pots of coffee a day, and he didn't understand why he couldn't sleep. Okay? One of the new crazes, right, are these energy drinks. If you are using an energy drink on a daily basis and you're struggling with sleep, I'm going to tell you that your energy drinks are causing or contributing to your poor sleep. Okay? Please limit your caffeine use, and especially after lunchtime. Okay? So if you have any soda or any kind of caffeinated beverage, we would recommend that you not have any after lunch. But I would really recommend that you really limit your caffeine use to a small amount because it can disrupt your sleep. There are, getting regular exercise is a good thing to do, but you don't want to do it right when you're trying to fall asleep. So if you want to go to bed at 10 o'clock at night, don't go to the gym at 8:30. Okay, because you're getting your heart rate up, you're doing all of these things, and that's contrary to what we're trying to do to help you fall asleep. Okay, bedroom environments, there's some tips there, about that, different snacks you can have. Here's another hard one, avoiding naps. Naps can be one of the biggest contributors to our bad sleep. I know that every time I take a nap, I'm not going to sleep well. And so what did I do today? I took a nap. And I know tonight I am not going to sleep very well. But man, I was tired. And I didn't want to be a blob for you here tonight at this lecture, so I took a nap. Now, the rule is, when you take a nap, don't take a nap after 3 o'clock, and the nap should be no longer than 30 minutes. And you're like, man, that's not a nap. I know, because it's bad for your brain, and it's bad for your sleep. But some people are so tired that they have to have some kind of nap. Fine, not after 3 o'clock, and no more than 30 minutes.
I can fall asleep at 3 o'clock in the afternoon in 5 seconds. But I lay awake, but I don't nap. But if I do nap, that's what happens. I go to sleep very quickly.
Yeah.
But I habitually lay awake at night, and my mind is going, and it takes me forever.
Yeah.
So why is that?
Why is it that when I take a nap, that I can fall asleep so quickly, but at night I just sit there and my mind's going?
Even when I haven't had a nap.
Even when I don't have a nap, because I don't nap very often. Well, you've trained your brain that when you are so tired that you have to have a nap, that your body will just shut down very quickly. And at night, you've trained your brain that there's lots of things that you do before you fall asleep. You've got to worry about all these other things before you fall asleep. So it's about brain association. It's about how you trained your body, and we need to retrain your body so that you can sleep better. And we're going to talk about some of these things to help you do that. So stop taking naps. Okay? Now, I took a nap, started at 3 o'clock, and I slept for an hour and a half.
Oh, boy.
Okay? So tonight's not going to be great, right? And I know that. That's my consequence. Okay? So please, if you want to improve your sleep, follow the directions. Sometimes, obviously, as a doctor, it's hard to take your own advice. I admit it, right? I'm not taking my own advice today, and I'm going to have the consequences tonight. And I know that. And tomorrow is going to be an awful day at work, and I will struggle. But I won't be able to take a nap tomorrow, so then I'll stay up all day, and then I'll sleep better tomorrow night, and the rest of the week will be fine. Okay? That's what happens. Okay. They talk things like a regular sleep schedule, so they don't want you to have a sleep schedule Monday through Friday, and then you party hard all weekend, and you stay up till 2 in the morning, and you sleep till 10 in the morning the next day, because that's not going to help you. Just try to stick to a sleep schedule as common as possible throughout the week is typically best. Okay. When that alarm goes off in the morning, don't push the snooze button. It really doesn't do you any good. You're not actually getting more quality sleep by doing that. So I know some people who set multiple alarms, and they know on their 5th alarm that that's when they have to get out of bed. Don't do that. Use that extra 30 minutes and actually sleep so that when your 1 alarm goes off, you get out of bed. Okay? So don't get into that trap of setting multiple alarms and pushing snooze several times. Just don't do it. Okay? You're gonna get a longer period of time of getting better quality sleep, and then you just wake up when you need to. Okay. Yes. Wonderful. Yeah. Wonderful. So pro tip here, she said that she was struggling with sleep and she found that she was just kind of turning her alarm off and then just falling back asleep. And so she had to move her phone to a different part of the room. So she actually had to get out of bed, grab her phone, and eventually she put it in the bathroom, her phone in the bathroom. So when she got to the bathroom to turn off her phone, she's like, oh, well, I guess I have to go to the bathroom. Goes to the bathroom, wakes herself up, and is able to move forward with the day. It's a great tip to move your phone so it's not right next to your night table where you can easily grab it from your bed and roll back over and sleep. So put it somewhere else. Okay? Great tip. Thank you. Any other? Yes, Brother Cornea.
Just if anybody has a few extra dollars, I hated alarm clocks my entire life. No matter what I did, I just don't like them. And even if I obeyed them, I hated them. And I bought automatic blinds, put them into our home, put them on a schedule. They come up, and somehow I just accept like, well, that's what that is, and I just get up and all right, the day started. And I don't really have a negative opinion about the blinds. I don't know why they're fine. Alarm clock, okay, blind, okay. So
Okay.
life wakes you up and you can't hit snooze, you just get up, you do your thing, automatic blinds. And they're battery powered, you don't have to have like a plug.
There you go. Technology is a great thing. It blesses our lives. Okay, use automatic blinds to go up at a certain time of the day to drag you out of bed.
Am I the only one who can only get up when the digit is a 0?
Yes.
Like if it's 13 after, I can't get up on 13. I can get up on 10 or 20, maybe a 5. No one else?
No one else. No one else. No one else. No, we call that something different. We can talk after if you want to talk about that. Okay, but we do. I mean, listen, that's a great example, but we all have some of these behaviors, these unhealthy behaviors that are not inducing our sleep, not helping us with sleep, and so we got to fix that. One thing, Sister Lending earlier said that she likes to go to bed and she likes to worry or think about all the things that she needs to do. Okay, this is called worry time. In our anxiety workshop, we talked a little bit about worry time, but worry time is very, very effective for those who are struggling with sleep. Okay, if you notice that in that time when you go to bed and you're trying to fall asleep, if you're thinking about things, life, things that you have to do the next day or the next week or things that are going on in your family or whatever, then what we want you to do is set a time for worry time. Worry time is before you get into your bed, you've got a notebook or you've got a planner or you take out your phone on your calendar, a to-do list or whatever it is you need to do, and I want you to write everything down. Everything that you can think of, what are all the things that I have to do tomorrow or this week or whatever. Okay, what's going on, and write all of those things out. And so what happens is that when you are trying to go to bed and your brain starts thinking about all the things you have to do tomorrow, because sometimes we think about them, we want to keep thinking about them so we don't forget. But what you tell yourself in your mind, you say, yes, I know tomorrow I have to take my kids here, and I've got to do, the laundry, and I've got this big report at work, and all of these things. And you can tell your mind, it's okay. I can't do it right now. It's not the time it's impossible for me to take my kids to soccer practice right now. Therefore, it's already written down. It's in the schedule. I won't forget. So your brain is more easily able to turn that off. Okay, your brain can say, oh, it's okay. I don't have to hold on to that because it's already written down. Okay, so brain dump. Brain dump through worry time. Get all of that stuff out on a paper. And when you think about it, we call it rumination. You start thinking about these things over and over again. Just stop yourself and say, it's okay. I can't do that right now. It's on paper. I won't forget. I'll look at my paper tomorrow morning and I'll remember I need to do that. Okay, so that's worry time. Very, very effective. Okay, so the next thing that we need to do to help you initiate sleep is one of the techniques that we started talking about in our anxiety class again, and that's breathing techniques. I need to know my audience here. Who was not here the second week where we talked about anxiety? Who was not here for the anxiety week? Okay, so several of you. Okay, so I'm going to teach you guys how to breathe. Okay, and then we're going to learn a very specific skill, a very specific breathing skill that works really well to initiate sleep. But most of us go through life and we don't know how to breathe. We never learned how to breathe. We just kind of naturally do it. Most people, if you ask someone to take a deep breath, their shoulders will come up, their chest will come out, they'll go, right? That's how most people would demonstrate a good deep breath. However, that's not a very great way to breathe when you need to calm your body down. So when you are asleep, if you watch anyone sleep, go home tonight, go watch one of your kids sleep or your spouse sleep. When we sleep, our diaphragm or your bellies go up and down very, very, very slowly. Okay? Very slowly. When we're asleep, our heart rate, our blood pressure, our adrenaline, all of these things are at our lowest levels while we sleep. Unless you're having a nightmare. If you're having a nightmare, these things are all elevated. But if you're having a normal sleep, all of your body is at the most calm state that you can be in, and you're using your diaphragm to breathe. Okay, so if we want to initiate sleep, if we want to fall asleep quickly, we have to learn how to take our body, which is at an elevated state, and we've got to calm it down. We've got to calm our blood pressure, our heart rate, all of these things. We've got to calm it down. And the way to do that is to breathe with your diaphragm or your belly. Okay, it's called diaphragmatic breathing. And so in our anxiety class, I taught you guys how to do that, and the way to do it is put a hand on your chest, hand on your stomach, and what you want to practice doing is just moving this bottom hand up and down and your chest being very, very still. Okay, so you can practice right now with me if you'd like, okay, but it's just going to look like this. Okay, noticing that my chest doesn't really move much at all, but my stomach does all of that breathing. What you're doing is getting a very full, deep breath into your body, really calming down. Now breathing like that sometimes isn't enough, and it's sometimes about the pace or how long you're taking those breaths for. And so what we have taught our folks in the anxiety class with diaphragmatic breathing is to count to 4. 4, 4, 4, 4. 4 seconds inhale, hold it for 4 seconds. 4 seconds exhale, hold it for 4 seconds. 4, 4, 4, 4. Okay? We had Brother Bigler here who said that one day at work, he was just very busy at work, and he did the diaphragmatic breathing, just took 10 breaths. He says, man, I almost fell asleep at work. Okay? That's the power of diaphragmatic breathing. It can really calm your whole body down very, very quickly. Okay, so I just want to very quickly walk through an exercise with you. I just want to do this 4, 4, 4 with you so you know how slow and how painful it can be before you really learn how to do it. Okay, so hand in chest, hand in stomach. I'm going to count to 4. I want you to follow my lead. We'll go through 2 breaths, okay, and see if you can do the 4, 4, 4. Okay, so here we go. Ready? Inhale, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. Hold, 2, 3, 4. Inhale, 2, 3, 4. Hold, 2, 3, 4. Exhale, 2, 3, 4. Now that's a long time. Right? That's a big breath, but that's really what you need to do. Okay? If you're going to have a medical effect on your body, a physiological effect, you need to slow your breathing down to that kind of pace using your diaphragm, and you will calm your body down very, very quickly. Okay? So there are lots of great exercises that you can use to help you fall asleep. One of them is called progressive muscle relaxation. So you're using your diaphragmatic breathing, and then at the same time, you're kind of different muscle groups one at a time. So you take your hands and you make a fist and you hold it, for 5 to 10 seconds really, really tight, and then you relax those muscles. And then you tighten your shoulders, and you kind of go through your whole body one at a time. The whole time doing your diaphragmatic breathing, the very, very slow breathing, but learning how to tense and how to relax your muscles, and that can kind of help. However, the number one breathing exercise that I teach to my patients to help them initiate sleep is on the back here, the back page. It's called autogenic relaxation. Okay, the patients that I work with say, out of all the things that you teach me, Dr. Nielsen, this is the number one thing that helps me initiate sleep the best. So autogenic relaxation, what we're doing is we're doing the diaphragmatic breathing, right? You're slowing your breathing down, and then in your mind, you're saying things like, my arms and hands are heavy and warm. Warmth is flowing into my hands. And you repeat that. And so instead of thinking about all the other things that you want to think about in the middle of the night when you're trying to go to sleep, if you can think about flowing, warmth, these are very relaxing and calming kind of words. And while you're doing that, and you're focusing on those words, and you're focusing on your breathing, you fall asleep very, very quickly. Okay? And then if you want to, you can go to a different part of your body, to your chest, your legs, your face. You can pick whatever you want. Now, I personally, so what I'm going to use tonight, because I know I'm going to struggle tonight, what I do when I use this breathing technique, I usually just pick one part of my body. I pick one part of my body, and I just use that phrase over and over and over again until I fall asleep. Okay? But it works. Very, very effective, very, very powerful. Okay? So this is great. Any questions about this? Okay. Do I what? Do I want a commercial? Great. So he said that his children had struggle sleeping, and so what they would do to help calm the children down is to think about every muscle in their body, starting with their head and going down to their toes, and it worked. It helped put their kids to sleep. Okay, so very powerful. Brandy asked the question, how long do I do this for? Going back to your sleep hygiene, if you're not asleep within about 15 minutes, get yourself out of bed. Okay, and I didn't go into those specifics as well as I needed to. So let's talk about that. So when you go to bed and you can't fall asleep within about 15 minutes. Now, I don't want you to be one of those people who every minute you look over at your clock and you're like, no, that's 7 minutes. And then 30 seconds later you look back over, right? That's not the idea, right? It's about 15 minutes. I don't need you to be, a Nazi about it. Just in general, about 15 minutes. You can't fall asleep. Get yourself out of bed. Now, what do you do? What do you do when you get yourself out of bed, and when do you go back to bed? Well, you don't go back to bed until you're sleepy. Okay, when your eyes get heavy, you start yawning, you think, okay, I'm going to go back to bed. Now, what do? Well, I'll tell you what you don't do. You don't get on your phone, you don't get on the computer, you don't watch TV, you don't do anything that is stimulating. You don't start cleaning your kitchen, right? We're not stimulating ourselves because that's going to keep us up. What I want you to do is go wake up, go grab something that is extremely boring, okay? A lot of you have really boring stuff, like if your kids are in school, grab one of their textbooks. If you're an employee, go grab one of your operating instructions. Go grab something that is really very difficult to read because it is so dense. Go grab a dictionary, right? Not one on the computer because, again, those blue lights, okay? But go grab something that is very boring, something that you're not interested in, and start reading it. And after about, 5-10 minutes of doing this very boring thing, you're going to start getting sleepy again. And then so you go and try to go back to sleep again, okay, for that 15 minutes. And if you can't fall asleep again, you get yourself back out of bed. And you keep doing this over and over again. You say, well, Dr. Nielsen, man, I'm going to be really tired that next day because I didn't sleep very good. You're right. So my recommendation for you would be to start this like if you know on the weekdays you've got to get up at 5:45 in the morning to get your kids to seminary, don't start this on Monday night. Don't start it tonight. Start this Friday night when you can sleep in the next day, or you have time to recover over the weekend, because you will be tired, because I've had patients who do this for several hours. Every 15 minutes they get themselves out of bed for the first night. Eventually your body's going to learn that you're so tired that the next day you're going to go to bed on time and fall asleep a little quicker. Your body will learn how to sleep. You require sleep. Your body's going to sleep. Okay? But you've got to, it's about training your brain, that your brain is not to sit there and think about all these things. Your bed is to sleep, and you're training your brain to do that. That's why you got to get yourself out of bed every 15 minutes. Yes, Rich?
I feel like you wanted to recommend the Old Testament, but you were just on.
Oh, yeah. It's great. Yeah, for most of us, right, the Old Testament may be really good. There's some weird stuff in the Old Testament, though, so that might spark your interest some too. Oh, is there some good sleep stuff in the Old Testament? Don't sleep? Proverbs got some good stuff too about sleep. Okay, I'll look that up. Wonderful. Any questions about initiating sleep? So you can do this, right, when you first go to bed, but if you wake up in the middle of the night and then it takes you 30 minutes or an hour to fall back asleep, you use this technique again. Okay, use your diaphragmatic breathing, use the autogenic relaxation. My arms and hands are heavy and warm, warmth is flowing through my hands, and you say that over again, help you fall back asleep. Okay? That's what you do in the middle of the night as well. Anytime you want to initiate or fall asleep, use these techniques. Any questions about sleep initiation? Yes? No, that's great. So if your wind down routine is, hey, I need to have my house somewhat clean before I start the new day, before my kids can terrorize it all night, and that makes you feel better so that you can be more calm and relaxed. If that's your wind down routine, do it. Absolutely. But when you go to bed and you say, okay, it's bedtime, and you don't fall asleep within 15 minutes, I don't want you to get up and start cleaning your house some more. Does that make sense? Get it all done before you go to bed initially. Okay? Other questions? Yes? If you wake up in the middle of the night and your mind is racing about all these things, should I write it all down then or not? Well, I would say if it's revelation from God, write it down, right? We know that President Nelson does this. I think that recently he was in Seattle, and his wife said that she has had some very wonderful experiences with President Nelson since he was called as a prophet, that there have been times when she has been asked to leave the room in the middle of the night, and that President Nelson, is going crazy on his yellow pad writing down all these revelations that he's receiving from Heavenly Father. Okay? So I would say those are great things. But for us, if you're talking about just temporal, hey, I need to tomorrow go to pick up dry cleaning. I would say it depends, but I think it's okay to write it down real quick, because you might start worrying, I'm going to forget if I don't write it down. And it's better just to take that 30 seconds, write that real quick down, just a little quick to-do list. You don't have to write out the whole thing, but maybe just a keyword, laundry, dry cleaning, and so that you'll remember that in the morning. And so I would probably write it down. Okay? Other questions? Yes? That's what we're going to talk about next. Okay, so what do we do if we're these people who wake up in the middle of the night, and you wake up 3 or 4 hours later, you wake up and you're like, oh, and you can't fall back asleep. Okay, and then, but you're tired or whatever. Well, one, you kind of try your diaphragmatic breathing. You try to initiate sleep when you wake up. That's one. But here's the other thing, okay? So this next, if you're that person who wakes up frequently in the middle of the night, this is the treatment for you. And this is an awful treatment. It's a wonderful invention because it works, but it is miserable. It's called sleep restriction therapy. Okay, sleep restriction therapy, what is happening is that you are likely going to bed before your body needs you to go to bed. And so what you have to do is you have to, if you typically, go to bed at 10 o'clock every night, what you have to do is you now have to start going to bed at 12 o'clock. And you go to bed at 12 o'clock. So the idea is you restrict your time in bed. And that next day you're going to be very, very tired, but you're not going to take a nap, and you're going to stay awake all day. You do everything you can to stay stimulated so you don't take a nap, and then that next night you kind of stay on that pattern, but you do it for a couple days. So if I typically go to bed at 10, I'm now going to go to bed at 12 o'clock, and I'm going to do that for a couple days until I sleep throughout the night. So the idea is that you want to make yourself so tired that when you go to bed, you will go to bed and stay asleep. Okay, that your body will just be so exhausted you will stay asleep the whole time. Okay, and so you do that, and you go to bed at 12 o'clock for a few days, and if you sleep all night for a few nights in a row, then you're allowed to then decrease it by 15 minutes. Now I'm going to go to bed at 11:45. If you're still sleeping throughout the night, great, you keep going down, 11:30, 11:15, 11 o'clock, you finally get to that point where your body is saying, okay, that's how much sleep I need. I'm not tired anymore. I'm getting the rest that I need. I'm sleeping throughout the night. I have trained my body to stay asleep. Okay, so that's called sleep restriction therapy. It is very effective. It works. Again, your body requires sleep. Okay, so if you force yourself to be very, very tired and you're not using a lot of stimulant medication or caffeine or doing things like taking naps, things to disrupt your sleep, but if you're doing it in a very natural way, your body will learn to stay asleep. And you then slowly bring it back to that level. And you might even be able to bring it back to 10 o'clock. You might be able to. You just maybe trained your body in such a way that it wakes up in the middle of the night. But you might go all the way back to 10 o'clock, and now you're getting your 8 hours of sleep that you really like, but you're sleeping throughout the night. But you've trained your body how to do that by making you very, very, very tired. Okay? Any questions about sleep restriction therapy? I mean, that's an easy principle, right? But it's very difficult. That's hard. And you need someone to kind of poke you when you're like on the couch and you're falling asleep. Like, nope, no naps. You got to get up and stay awake and do stuff. Okay, that's the tricky part about sleep restriction therapy, is to stay awake that next day and not take naps. It can be very difficult, but that's how you resolve that issue naturally. That's how you get over it. Can you restrict your sleep on the other way? I've never done that, but could it work? He asked the question of, instead of restricting your sleep at the beginning of the night, get up earlier. I think that it kind of would defeat the purpose, because you're again training your body to get up earlier than what you want it to get up. So I think what we're trying to do is get you to sleep throughout the night. I would probably say no, that wouldn't be very effective. I think it would actually train your body to do the opposite. Have you ever heard of, that you don't sleep at all, but you're so tired you can't sleep? Most of the people that I have worked with who've been in that, there are other behavioral things that are impacting those issues, like over caffeine use, or some kind of medical issue, potentially like sleep apnea, restless leg syndrome. Chronic pain is absolutely one of those things. So chronic pain, we know, can interfere with sleep, and so that is one of the things that can kind of disrupt sleep quite a bit, depending on the pain, and just trying to then figure out how you can get as comfortable as possible, depending on where the pain is, to sleep. Yeah, chronic pain can be one of those issues, and with chronic pain, it would be so individualized that we would want you to get with, your doc, your orthopedic doc, or whatever doc's dealing with your pain. You have maybe a pain specialist, and have them really, look at that and figure out a way that we can create an environment or a position or something, some sort of thing to help sustain sleep without the pain waking you up or causing even, it's really waking you up. Yeah. And doing it without overusing your opiate medications or other things too, because that's a slippery slope, and taking our medications or our opiates because of the pain also can, over time, that chronic use, the chronic use of those medications also can be disruptive to sleep as well. It depends on the medication, yeah. It doesn't matter. Okay, good question. Any other questions, thoughts? Yes?
Can you use the 15 minutes maybe to get yourself back to sleep if you wake up? Or do you recommend doing the sleep training thing every time?
So in the middle of the night, if you wake up, should I use that 15-minute rule again as far as I get out of bed if you're not asleep within 15 minutes? Is that the question? Yes. Okay, so again, it's about brain association. So if you wake up at 3 in the morning, you don't want to be up at 3 in the morning, but you can't fall back asleep, get up, okay, very dim lighting, read something boring, okay, you're going to probably, honestly, you probably won't fall back asleep that night. You'll be very, very tired the next day, but you'll be so tired that the next night, hopefully, you sleep throughout the night. But I do not want you to just lay in bed and thinking about everything, okay, so get yourself out of bed, and then try to go back to bed once you're sleepy. Okay, good. Other questions? That's why she asks so many questions? She's kind of like, yeah, she does. Yes. Brandy's actually, she says she's coaching me, so she knows the things that I'm missing that I'm not telling you guys, and she's a good companion. She keeps me straight.
How do you know how much sleep your body needs? That's kind of a silly question, but I wake up around 5:30 most days, and I'm kind of always tired. I'm tired earlier, some nights you almost hit the others, but is there a point where realistically you wake up and you're not tired? I mean, is that kind of the goal? You wake up at 5:30 and say, hey, I'm ready to go today?
Yeah, good question. So the question is how do you know how much sleep you need? Is there ever a point when you wake up in the morning and you say, oh yes, the day, like the Lego movie, right? And you're like, jumping jacks. and right? Do you ever get to that point? I don't know anyone who really just is full of energy immediately when they wake up. And so I think it's okay to feel a little groggy, to feel a little sleepy when you get up in the morning. The trick would be, what I would say, are you getting enough sleep, would be, do you experience some daytime drowsiness? Do you really feel like you need to take a nap? Do you feel like you need caffeine to keep you awake? If you're saying, I need these things, then I would say you're not getting enough sleep at night. Okay, if you're saying, no, I feel fine throughout the day, I have energy, I don't feel like I need to take a nap, I'm not falling asleep in random places, I'm able to get the things done that I need, then...
Do people get turned on if they wake up about the right time without their alarms?
Yeah, so a question is can you sleep good enough to where the point where you don't need an alarm? You just wake up at the same time and you feel great and you move on. Some people do. A lot of people do actually just have a natural clock where they wake up at a certain time or after so many hours. They can wake themselves up, and that's a very natural way to do it. That's great. Not everyone experiences that. In fact, there's some studies out there that say people who are depressed actually will wake up before their alarm clock goes off. That there's some correlation there for people who are depressed and some of their sleep patterns and cycles. And so, again, it's so individualized and we're so different with our sleep and our sleep patterns that we're all going to respond differently for that.
Is there any hope for like a first responder, firefighter pattern where they get in sleep 24 hours minimum, 24 hours?
Yeah, So is there any hope for our first responders or for people who do swing shifts quite a bit, or their time at work changes frequently? Very difficult. So our recommendation in the Air Force, we have people who work people are at the base 24/7, and they sometimes some units they'll every 2 weeks they'll switch shifts, and we tell commanders all the time, it's so unhealthy for you, it's so bad for you. We would want someone to be on the same shift probably for at least 4 months, and you're on one shift for 4 months, and then not every other week kind of stuff. That's really, really hard for your brain to learn a new sleep pattern, a new cycle. So our firefighters especially, I think they typically do like 24-hour shifts. Some of our medical professionals sometimes do 24-hour shifts. That's so bad. It's so hard to get into a sleep routine and train your brain to do that. Typically what they have to do, they do require some naps actually to continue to function. We just typically would like for them to take a nap. If they're starting a shift, take that nap like right before they start their shift, an hour. Go ahead and sleep that hour right before you start your shift and do that. But it can be very, very difficult to do for those guys.
With everything that we talked about tonight and everything, would you recommend all of this exact same stuff for a child who has a lot of trouble falling asleep every night due to anxiety?
Yeah, so would I recommend this for a child who has anxiety to do these behaviors? Yes, I would, but I also think that the anxiety is probably contributing significantly to the sleep issue, so I would really want to treat the anxiety as well. You may not make a big dent in the sleep until you get the anxiety under control a little bit. So I would want to make sure that we're doing both and not only focusing on the sleep. You probably can make improvement with the sleep, there's no doubt. Even with a small child, have that child, even though they don't want to write it out, have them give you the worry time, and you as the parent write out, hey, what are all the things you need to do tomorrow? What are you thinking about? When you lay in bed, what's on your mind? Write all that stuff out for them so that they have it the next day. Teach them diaphragmatic breathing, learn how to use their belly to breathe. Teach them some phrases, count sheep, or whatever they want to do to kind of help. Instead of thinking about other things that they're thinking about or worrying about, help them think about something positive, their muscles, whatever. They can make improvement for sure.
So for someone who, again, one of the topics where someone wakes up after several hours of sleep, they fall asleep all right, but due to, say, somebody who's got PTSD or some traumatic experience, maybe has nightmares, and it wakes them up, and then finally they fall asleep, how would, I would imagine these things would help to a certain degree, but are we looking at maybe more of therapy at that point that's going to be beneficial, or combination, or how?
Yeah. So the question is if you know someone or you're someone who has a trauma history, you've been experienced some sort of traumatic event, you have post-traumatic stress disorder. One of those common symptoms are having nightmares in the middle of the night. So if you're that person and you wake up in the middle of the night, what do you do? Again, so first things first is one, treat the trauma, right? There's really good evidence-based treatment for trauma. It's probably one of the most favorite things that I treat because I can really make those horrifying memories not impact you anymore. That they're just a bad memory, and then the nightmares go away, and that I can get rid of the nightmares. Okay, so that's number one. Number two, when you have a nightmare, what's happening to you physiologically? Your heart rate is increasing. Your rapid breathing, right? Adrenaline is really high. So all of these things are happening. So yeah, probably you're going to get out of bed, but what I would need you to do, instead of going out and watching TV or doing other things, calm yourself down. Use your diaphragmatic breathing that you've learned to slow your heart rate down, slow your adrenaline down, your blood pressure, all of these things. Tell yourself it was just a memory. I'm safe. I'm okay. I'm in my house. Really ground yourself to your surroundings, that was just a memory. It was just a bad nightmare. Use your diaphragmatic breathing and try to go back to sleep again, okay, to calm your body back down. There is also another technique called dream rehearsal therapy, where you can, when you're awake, you consciously, repeatedly over and over again, create a different ending to the nightmare. So if you have the same nightmare over and over again, you can create a different ending, you create some markers, some things to remember, like, hey, I'm going to see a red, if I'm a combat, so if I'm talking about combat trauma, my military folks, and they're out in the desert and they get blown up, well, if I can create a marker before they get blown up about a red fire truck, which doesn't exist in the desert, it's very odd to be there, but if I can get them to have that image in their nightmare, then that kind of helps create an alternate ending before they get blown up, and can maybe make them the nightmares not occur as frequently.
Now, is that something they would use therapy to kind of teach them that?
Yeah.
They would, okay. And then I'm guessing therapy do CBT to help with the trauma. You mentioned this earlier.
Yeah, so for trauma treatment, there's 2 treatments that I would recommend. One's called prolonged exposure. The other one's called cognitive processing therapy. They're very specific treatment for trauma, but very, very effective. Yep, good questions. Okay.
I assume you're maybe going to tie something in, so if I'm jumping ahead, I apologize, but I wanted to share my personal experience that is related to this, because I sense that maybe somebody might benefit from it. I had bad sleeping, bad eating, and bad exercise habits all my life, most of my life, from sort of teenage years all the way through adulthood. And so there's some chicken and egg here, because when I wanted to, and I struggled with life-crippling depression, like really just the worst of like on that survey we took where you rated it, it was 27, like just trying to function was difficult. And I would talk to friends and even doctors or therapists who would recommend these kinds of things. Hey, get some better sleep, do exercise, eat some vegetables, and I would try these things, and they're helpful, but some people may also benefit. I finally got to a therapist to help me go through this stuff we've been talking about for 5 weeks, and got me to see that, hey, there are some big things probably broken early on in life, in childhood, that have created some really big obstacles. Let's get in there and let's try to deal with this stuff and fix it. And it was pretty challenging and pretty painful, and I didn't really trust that things that were that broken could change. I was in my 40s, and the idea was, I'm stuck. This is bad wiring. This is what I've got. And I just want to say that the wires could be rerun, and they were. And I accepted the homework given to me, and the therapist said, I want you to do this. And I had the faith. You're a professional. I trust you. God wants me to be well, and I'll try it. And I did it. And it turns out it just wasn't terribly complicated to face some of these very painful, scary things. And the long way around it is that I had a few miraculous experiences, and I'm quite different in a lot of root ways. Like, I just don't think the same. I don't operate the same. And as a byproduct, I sleep much healthier. I eat better. I lost a ton of weight. I like vegetables, and I enjoy exercising. So things that were symptoms could have been helpful to work on, but it was also interesting when I really just brought my worst fears and things before the Lord with faith, that if anything good could happen, it could happen at His hand, and really kind of took the time to be in that place that was a little scary. All these other things just changed along with it. So if that's inspirational to anybody, I hope. If not, I'm sorry. I just don't
No, Rich, thank you for sharing your testimony about that. So I mean, you're adding credibility to what I'm doing here, right? So at the end of the day, right, Rich is saying, look, I was in a dark place for a long time, struggling, just at the point of just saying, hey, this is just my life. Nothing's going to fix it. I'm not going to get better. Went to some treatment, said, okay, I'm not sure if I really believe you, but you're a professional, so I'll give it a shot. Turned it over to God as well and said, look, I know you want me to be happy. You want me to experience joy in this life. And he was compliant. He did the things that his therapist told him to do, and he found significant relief. Had very spiritual, wonderful experiences as he found a new self, found some core beliefs that were healthy and able to make significant change in his life. And that's what this is really about, right? So yes, some of the things that we've talked about over the last 5 weeks, some of them can be very difficult. It can be very difficult to make change in your lives. There's no doubt about it. Okay, but if you go and you turn to Jesus Christ and you say, you know what, I'm really struggling. I'm your child. Please help me. And you go to treatment and you're compliant with treatment, Do the things that your therapist asks you to do. Do the things that I have asked you to do, and you will make significant improvement. Please get professional help. Okay, sometimes it's hard to do this on your own. So please seek a professional provider who's been trained in these things. It would be recommended that they have a same sort of religious viewpoint as that you do. Can be very, very helpful for you. But it can be very powerful, life-changing. We have recorded, so if you've not been at our other workshops, we have recorded them. The audio as well as all the handouts are linked, but it's on YouTube. So if you go to YouTube and you just search Christ-Centered Depression and Anxiety Workshops, Brother Fulkerson has been great. He has posted all of the recordings there. All the handouts are there, linked to them. So please go back and review those or share them with your friends or family members, loved ones that you are worried about. The last thing, too, is that your feedback is very important to me. This is the first time that we've done anxiety and depression workshops combined in 5 weeks. It's the first time we've done it over an hour and a half period of time. Last time we did 1 hour. So I'd like for your feedback. If you could, please fill this out. Sister Nielsen has a box here. She'll put the box on the back table there. If you can just drop off those feedback forms so that I can collect your feedback on that. So I'll just end here with my testimony that I know that these principles that we've been teaching are principles that God has inspired man to have so that we can better improve our lives, so that we can move forward with faith and do his work in building his kingdom on earth. That's why we exist. And he's given us modern medicine to help improve our lives. He wants you to be happy, there's no doubt. He also wants you to feel stressed. He wants you to experience these struggling things in our life so that we can be humble and have faith sufficient for salvation. But there's no doubt that he will walk every step with you as you turn to him and you have faith. You're never, ever alone. He has never forgotten you. He is there with you through it all. And we, as humans, will experience some ugly things in our lives. That is what our mortal existence is for. That's what we signed up for when we decided to come down here in the premortal existence. But I testify to you that he loves you, and that the gospel is true, and that there will be a time. President and I were singing a hymn today, and it said, we will not have strife until we die, right? I think once we get to the afterlife, and we are no longer in this mortal tabernacle, that's when strife will no longer exist, okay? I still think, though, that there's such thing as godly sorrow, right? I'm sure that Heavenly Father still has tears for us when we struggle. So it's not like, there won't be any emotion in heaven. I think there'll be plenty of emotions in heaven. I think we'll have all the emotions. But the strife that we struggle with here in this time will not be there in the life after. And I say these things in the name of Jesus Christ. Amen. Sister Lending, would you mind giving our closing prayer?